Hi, my name is Lauren Massey. I'm a doctor of physical therapy and board-certified orthopedic clinical specialist. I'm also the owner and clinical services director at Bay Area Physical Therapy and Lafayette Physical Therapy. Today we're going to talk about reducing the risk of falls with physical therapy. There's many things that can lead to falls, and I want to make sure that you guys know it isn't always about just being older. Definitely aging and neurologic changes can lead to falls, but also after injuries or surgeries, even a young person could be at greater risk of falling. Sometimes injuries and surgeries can lead to increased weakness. We lose proprioception, which is knowing where our body is in space. Sometimes you could even have vertigo or vestibular issues, which just throws off and makes you feel dizzy. That might lead to falls. These are all things that we can address in physical therapy. And we at Bay Area Physical Therapy and Lafayette Physical Therapy have certain physical therapists that are specialized in these different niches. For example, we have therapists that can evaluate vertigo and vestibular issues. We have therapists who have advanced training in treating Parkinson's disease, which often can cause people to have a shortened shuffling gait where they might drag their toes and be at greater risk for falling. So we certainly have someone who we feel can give you a thorough evaluation, really get to the root of your cause that could be putting you at risk for falls and stop it before it becomes a problem. We definitely don't want you to fall and have that lead to other injuries, broken arms, broken hips, and sometimes even hospitalizations. Physical therapy plays an important part in improving impairments to get patients to feel like they can be independent and safe in the community. We also have research to support that physical therapy does reduce the risk of falling and number of falls in people who have shown a risk to begin with. We want to make sure that you have the strength and balance to be able to let you be independent in the community, play with your children and grandchildren in that grassy field, and not be afraid. You have to be the first one to reach out to us for that help though. So if you start to notice things like you need to pull yourself up that stair railing to get up the stairs because your legs are feeling weaker, or you're just too afraid to go walk through the grass or walk on the beach with your family members, or you go to get out of a chair and you have to use your arms because your legs are starting to get too weak. These can all be early signs that you might need to reach out for a program to make sure that that doesn't escalate quickly and lead to an increased risk of falling for yourself. So if you think we can help, please reach out to our front desk for a complimentary consultation or evaluation as soon as possible. Thanks so much.